There are extreme cases of the flu hitting the Bay Area right now, including right here in the KTVU newsroom. Now, there are also cases of norovirus striking around the country. And for more insight, I'm joined now by KTVU medical expert Larry Burchett. Larry, thank you so much for being with us via Skype.
Good to be here.
So first, let's just get talking about the flu and the norovirus. We're talking about two very different things. Can you describe the difference between the two?
Yeah, it can easily get confusing because we refer to stomach bugs as a stomach flu.
Right.
But the flu really refers to influenza, which is a respiratory illness, and it peaks about now, January, February, body aches, fevers, sore throat, cough. It's a respiratory illness. So it's transmitted that way too. Washing your hands and covering your mouth or not coughing on people, the way to prevent that. On the other hand, norovirus is an intestinal virus. Vomiting, diarrhea. Again, we call it the stomach flu, but it is not influenza. They're very different, lungs, respiratory versus intestines. The symptoms are very different.
And the cases that we've been hearing about recently with norovirus have been drastic. I know in the Midwest there have been issues where schools have had to shut down because a nurse was sick and kids were sick, and it's been really bad. I mean, and it seems like it's difficult to ward it off when someone inside of your home has it. What suggestions do you have?
Norovirus is notorious for being very contagious. So number one, like we always talk about, wash your hands. There's some concern even with this one that alone is not good enough. So I can understand why local officials might want to close schools, kind of limit the outbreak. If you happen to get it, that's one that you need to stay home and not go to work or school, precisely for this reason, because it's so contagious that it can spread around a small community quickly.
And talk to us briefly about how the norovirus can spread.
So norovirus, we say fecal oral. So because it's in your intestines, mouth, vomiting, diarrhea, you get it on your hands, it's contaminated that way. Again, washing your hands being a key way to prevent it.
And so getting back to the flu now, we've heard about the flu spreading so much more, especially here in the Bay Area. We've seen a spike in hospitalizations from what I hear. Why do you think that is?
This is flu season. We see this every year. I've seen so many people now in the ER that come in and they feel terrible. The influenza makes you feel really sick. Normal, healthy people get it and they feel like they're dying. And then those that are kind of on the fringes, maybe they have lung disease, they're older, or even the younger children under 2 are particularly vulnerable and sometimes end up needing to be hospitalized. But this is an annual, every year, December, but really January, February, we get hit with influenza, with the flu. It's kind of right on time as we would expect.
Yeah, and everybody around here at the station has been getting it. We've been trying to kind of just make sure that we're all cleaning and, using our hand sanitizer and trying to make sure that we're being very careful about that. Larry Burchett, thank you so much for joining us via Skype. Good seeing you again today.
Good luck. I hope you stay well.
Thank you.